I had the privilege of chairing a very nice session yesterday focused on how can we define success in CLL, and this was a very multiplayer session where also patient representatives were involved, and it was nice to see that we have some important goals in the next futures, including better defining and improving the quality of life of patients with CLL. The patient representative pointed out that probably achieving undetectable MRD is a relevant point in order to administer fixed duration treatment and to provide the patient with some time off treatment, so-called treatment holidays. But we have also definitely to take into account the patient perspective also in designing clinical trials, because the point here is that with novel targeted agents we are definitely improving disease control over time, so we are prolonging progression-free survival and overall survival, and we need to understand how to identify better treatment earlier instead of waiting for years before seeing a difference in terms of progression-free survival and overall survival. And probably testing for measurable residual disease, testing for improvement in immune function and improvement in quality of life, that would be a way to understand if the new therapies are beneficial earlier than if only checking for PFS and OS.